Good afternoon, everyone, and welcome to PACT's Digital Health Series. This program is going to be focused on understanding the 21st Century Cures Act. My name is Dean Miller. I'm the president and CEO of PACT, and we're excited to have you here this afternoon. We've got a great panel, more on that in just a minute. But I first want to recognize and thank our supporters, led by Arcweb, Dwayne Morris, Eisner Amper, Independence Blue Cross, and Troutman Pepper. 5 firms really dedicated to the digital health space. We're excited to have some representation here today. Today's program is a webinar. As you know, please stay on mute, but you can ask questions and we encourage you to do so. Please feel free to raise your hand. Our group will be small enough where we could do that. But the most efficient way is to use the chat box, which I think by now you probably are all aware of how to do so. Our program is going to run till about 3 o'clock. And toward the end of the program, I'll come back on and make sure that you get a link to our Remo virtual networking room. And if you haven't experienced it, it's a great opportunity to connect with speakers, fellow participants. You can jump from table to table, have some brief conversations, but it's a really great way to efficiently connect with a couple people this afternoon. So again, be on the lookout. We'll announce that toward the end of the program. We'll have about a half hour in the Remo room, from 3 to 3:30. With that, let me kick off and introduce Kurt Schiller. Kurt is one of the leaders of healthcare at Arcweb. He is someone who's been just a real great contributor to the technology community in general, a terrific supporter of PACT. We really love working with Kurt and the team at Arcweb Technologies. And I want to welcome you, Kurt, and thank you for moderating this afternoon's conversation.
Absolutely, Dean. And thank you so much for that great introduction. And thank you to everyone for joining us today. So as Dean so kindly mentioned, I'm Kurt Schiller from Arcweb Technologies. And today we're going to be talking about the impacts of a major piece of healthcare data regulations. And so to discuss these impacts today, we are joined by 3 panelists, each of whom brings a wealth of expertise on patient data and its applications. And before we get into the meat of the discussion, I'd love for us to just kind of real quickly go around and introduce ourselves. I'll start. As was mentioned, I'm Kurt Schiller. I'm a healthcare analyst for Arcweb Technologies. We are a digital transformation agency that works with innovators and growth-focused leaders to design digital products and custom software that creates business value with a particular focus on the healthcare industry. My background is actually in technology journalism originally, where I reported on archival and content technologies for a number of years, after which I worked in the digital communications and the managed care industry, where I saw firsthand many of the data and information limitations of the industry that we'll be discussing today. Next, we'll go to Pooja, then Josh, then David.
Great. Thanks, Kurt. Nice to meet everyone. Pooja Bavara. I'm the PBM lead for Point of Care Partners. Point of Care Partners is a health information technology consulting firm. And my background is actually product management and strategy, primarily on kind of the pharmacy side, pharmacy PBMs, and have worked with a lot of healthcare technology companies. At Point of Care Partners, I work primarily on strategy engagements for our clients, but have recently also started put together a report on interoperability. So a lot of the topics that we're going to be talking about today, we follow what's happening in DC, we follow what's happening with industry associations, and also some of the accelerators that are focused on interoperability. So really excited to have this conversation, and thanks for having me.
Yeah, my name is Josh Lamb. I am a technical architect at Optum. I'm actively working to utilize the interfaces that are exposed through the CMS and ONC interoperability rules. And yeah, prior to being at Optum, I was technical lead, also implementing the CMS and ONC, the patient access rules in that case at a health plan that was based out of Pennsylvania. So very excited to be here. And I absolutely love interoperability, and I'm just very happy to be here and having a discussion with everybody today.
Dave Lee from Levitt Partners. I'm a lawyer by training and spent some time on Capitol Hill as well. Do a lot of work in the interoperability space, and relevant to this conversation, help run what's called the Cairn Alliance. And the Cairn Alliance one of the HL7 accelerators that Pooja talked about. We have about 75 members focused on facilitating consumer access to their healthcare information, primarily on the payer side, and hoping to advance consumer-directed health information exchange that way.
Well, thank you very much, everyone, for your introductions. I'm very excited to get started with the conversation proper. Before I somehow tabbed away from my notes, if you'll excuse me. There we go. So before we get to our discussion proper, I wanted to give some quick background on the talk, since this is a very complex and in-depth topic. This is not meant to be a full primer on the 21st Century Cures Act, which is a rather vast piece of legislation. And we're really going to be zeroing in on primarily the aspects that affect healthcare data sharing. And in particular, the information blocking provision, the interoperability requirements that were mentioned, and the patient access API requirement. And these are two very impactful pieces of oversight out of a larger bill. Because, in very basic terms, up until very recently, the overwhelming majority of healthcare data, and that encompasses diagnostic data, billing and claims data, even outcomes and demographic data, has not been actively or readily shared between healthcare actors, including often with patients themselves. And it's really been siloed piecemeal within disparate healthcare organizations. So, insurance payers would have one piece, your doctor would have another, data warehouses and information exchanges might have some higher level view of things, but really none of these organizations were necessarily mandated to be talking with each other. And the Cures Act is really working to change this, again, among other things. And it's really through two particular sub aspects of it, I guess. And the information blocking restriction, or I should say requirement, is a variety of healthcare actors, in particular providers and certified IT vendors like EHR developers, will now be required to share data much more freely, and specifically when requested by an authorized person. There's a lot of complexities and nuances to that I'm sure that we'll get into. But simultaneously, through the patient access API requirement, payers, and in particular government-funded payers, are being required to make claims pricing and some other forms of data available to their consumers in a standardized form. And both of these are really very significant developments. And this is all a very long-winded way of saying that the healthcare industry in general, and consumer and B2B industries in and around healthcare, are about to begin getting access to vast stores of data that were previously only sporadically accessible. And this obviously is going to have lasting impacts. So all of that said, let's get started with our first question, which I'll be passing over to Pooja, which is, we're a little over a year past the publication of the ONC Final Rule, which essentially transformed the Cures Act from a piece of legislation into functional enforcement guidelines that could actually be enforced. And we're actually just now coming up on one of those guidelines on one of those deadlines, rather, on July 1st. So given that the industry has had some time to react, I'd like to ask each of you this two-part question, which is, first, have you already seen the impact of the Cures Act patient data components in your own corner of the industry? And for the second part, how would you judge the healthcare industry, either as a whole or your particular corner of it? How would you judge their readiness as we close in on some of the mandatory enforcement periods? And like I said, we'll start with Pooja first.
Sure. Thanks, Kurt. So as I mentioned, I do a lot of strategy engagements with different stakeholders kind of across the industry. And what I've seen is, you have a handful of folks in the sector who are really more on the bleeding edge of what's happening with the Cures Act, right? The payers and some health IT vendors who were, really at the very beginning, starting to kind of figure out what this means, work on developing the standardized APIs, the ones who were standing up fire servers for testing and implementing. And then on the other hand, you had those that were actually, just scrambling to even understand what these final rules were. I think the word that you said, right, is mandated. I think, you know, a lot of kind of the stakeholders in the industry, when they look at this, you know, it becomes this, oh, we have to do this. And what I found is in talking to some folks, you know, they're really looking at this as potentially a competitive advantage. I think that's really where we need to be kind of focused on this. Is of course it's being mandated by ONC, other rules being mandated by CMS, but those payers, health IT vendors, even provider groups that are looking at this as you know, how can this actually help them in their business? How can they take strategic advantage of it? Those are the ones that we are actually seeing really kind of leap forward on all of this, as opposed to those that are kind of looking at this as a mandate. And I'll just share a quick story before we pass that along to others. But you know, our point of care partners, one of my colleagues, Jocelyn Keegan, is a program manager for another accelerator under HL7, the Da Vinci Group. And what I've noticed is, you know, it started out with really the payers that knew these rules were coming to say, we don't have an easy way to share information. We know that our data has been siloed. We know that we haven't been, you know, in the past haven't really opened it up. So how can we develop standards? You know, how can we work together in order to share this information? And we've actually seen kind of a shift in membership from just payers and health IT vendors, where we're actually seeing providers come to the table now too. Because I think when I think about who we work with, it's a lot of the provider groups that have been a little bit lagging in terms of readiness. So to answer your second part of your question in terms of readiness, I would say we've got, you know, a handful of folks that were, you know, ahead of the game. They really knew what was going on. You have those groups that are unfortunately just kind of now showing up to the table saying, okay, we know how we have something, we have to be doing something. What does that mean for us? And just one thing, you know, you also have to be looking at this as who can you partner with, right? Because you can't do this alone, especially with the data sharing pieces. So.
Yeah, amazing points, Pooja. I completely agree that just looking at this as a like a compliance checkbox and doing the bare minimum would cause you to miss out on what can really be tremendous opportunity and something that I feel is going to revolutionize how we administer healthcare. So one of the more powerful things that I had seen, and Dave, as being part of the Care Alliance, is you know, very aware of as well, is that industry collaboration at this scale in healthcare, I don't think has ever been seen before. So this is really enabled through the open development and sharing of standards, where we'll go in as an industry and look at a draft version of something and we create it together. So through that collaboration, it's really changing how we think of the other entities that we interact with in healthcare. And I hope that these discussions, which I've been hearing with increasing frequency lately around how do we really leverage this in order to help the patient. I mean, that's the one thing that all of us, even who may compete in the market, have in common is we're all trying to focus on the patient and how to improve their interactions with healthcare. So yeah, again, if it's a little scary at first, and that's sort of the gut instinct from a lot of payers and providers, is a protective instinct. But the more you work through it, you see that these things are out there for a good reason. There's good intentions behind them.
Yeah, and I just point out, and I think this will be a theme throughout the conversation, the point that Congress was trying to get to with the Cures Act and, you know, the administration, both the Trump and Biden administrations, in advancing some of their rules, was trying to make healthcare act a little bit more like a normal market and reducing some of the information asymmetry that exists. And so as you look, I think, you know, Pooja and Josh make really great points. It's not just a compliance component. It's what is the government trying to push the market to do, right? More data liquidity. It's not just that you have the data as an asset, but what are you doing with the data? How are you helping a beneficiary or a patient? How are you reducing costs and taking those out of the system, and really trying to move that forward? You've seen that with the Cures Act, the No Surprises Act, the interoperability rules, one of which is still pending, the interoperability and prior authorization rule. So it's a lot of action in Congress. It's a lot of action in both administrations. It's bipartisan, and it's really trying to move the ball forward in transparency, consumer empowerment, and trying to move that forward. Now, part of your question, Kurt, was what have we already seen as far as, patient empowerment? I think a lot of great stories of people getting their health records, through the Argonaut spec or getting their claims information, either through Medicare Blue Button or Caring for Blue Button. I think that there's a long way to go. Those data sets are incomplete and not always useful for everything that patients want to do, especially if you're really sick, if you have multiple chronic conditions. And so expanding the data fields and the data sets and the US CDI, moving that and maturing that is going to be really important. So it's not that we're done. This is very much a starting point, and just would underscore again for the last time, well, probably not the last time for this whole conversation, maybe the last time for this question, it's not a compliance exercise. It's a business opportunity to advance and gain competitive advantage in the market.
Yeah, I love your point, David, about and I think that both Josh and Pooja also touched on this, that it's not being treated purely as a compliance exercise, which I think that you would miss out on, and both you as in the industry and you as in the patient, really everyone in the healthcare system in some capacity, which is essentially everyone, would really miss out, because it's kind of a unique scenario to me from a technology point of view, where this data exists. We've been collecting this data, and it's just been very, very difficult to get access to that value in any kind of persistent long-term way. And so it's not as if we're starting suddenly, on July 1st, collecting this data, and then we're going to have to wait a while. This is these, reservoirs of data that, as you mentioned, we don't always know necessarily their completeness. We don't always know if the standard that was used is an effective one. But the value is there. It's like you suddenly discovered, a vein of gold directly underneath where you lived, and it's like, okay, well, now what's the right way to get at it and turn it both into business advantage and also patient outcomes, which are I'm glad that came up already, because that's such a huge aspect of this. So for the part of the Cures Act that has gotten the most headlines so far, I think, is probably the information blocking provision, which basically restricts specific healthcare entities from withholding or obfuscating most patient data. So for instance, previously, I'm sure that many people, when they have changed primary care providers, have had to go through some kind of rigmarole to get their records sent from one office to another office. From a technology standpoint, if you imagine that experience writ large, you'll begin to understand kind of what the technology challenge was there. And in particular, EHR vendors, providers, and kind of healthcare exchanges are the ones who are subject to this. Many vendors, though, in particular the big EHR vendors, are claiming to already be in compliance with this rule. And they're essentially saying, well, we already have mechanisms for sharing this data. We believe that we have already met the threshold that is required of this. And so I've seen people also suggesting that maybe this won't be a momentous sea change. So Josh, I'll direct this one to you initially. How much of an impact do you think the info blocking rule in particular will actually have on the industry? I guess let's start with the short term, and if you feel like going long term with it, I'm happy to hear that answer too.
No, yeah, absolutely. So there's a lot of different actors in healthcare. So different entities, depending on their size, scale, whether they're a payer, provider, health information exchange network, are going to react a little bit differently. So your doctor, your local doctor will think of this a lot differently than like Epic or Cerner or a large EHR vendor would. But going back to the point of this just being a compliance checkbox versus I'm trying to do this well, there's varying degrees to which someone could meet these requirements. So again, if someone is looking at the information blocking criteria as that low bar, I'm going to do this and that's all I'm going to do, and now I'm not going to get dinged. So like that's going to be a much different experience than someone who really sees this as the opportunity that it could be. But I think one large milestone is going to be getting healthcare providers to expose their FHIR compliant R4 interfaces and make this available through their through the provider directory, or NPES, as we like to refer to it. So what I've seen most recently was, if you look in there, it's almost, in the event that they do list a FHIR server, it's maybe a FHIR STU2, which is an older version. So at least a few weeks ago, rather, I wasn't seeing a lot of adoption within that database. So now, if your EHR is compliant, that doesn't necessarily build the link between you as a provider and me as a patient who knows you as Dr. John Smith with MPI 1234. We have to kind of take that additional step and be able to resolve from me as a patient to you as a provider, and then from there, which EHR is hosting your FHIR data. So getting to that point is also called out in the information blocking rules, where you'll get put on like a naughty list. So you'll get publicly shamed, probably to a very small degree, but I'm not quite sure that CMS or ONC have at least put in strong terms exactly how this enforcement will be monitored, what steps will be taken. And I do suspect that some entities will be waiting for that more specific guidance to come out before they really decide how they're going to react. But yeah, opening this up to the group, I'd love to hear what everyone else thinks.
Yeah, Josh, I'd just underscore that. I mean, as a system architect, you know this a lot better than we do. I mean, the technology, in large part, Kurt, I think is there, right? It's more about the cultural change of saying, look, we're not going to keep this data in a vice grip anymore. We're required to share it, and we're going to share it, right? And we're going to change the paradigm from trying to monetize having the data to monetize what we do with the data. We're better at helping the patient. We're better at serving our providers. We're better at facilitating data exchange than just, we've got a better data set than you do. And I think that paradigm shift is going to be really important because, Josh, you can speak to this better than I can. I mean, at-rest API technology has been around for a long time, right? It's not having it, it's using it, to Josh's point. So can we discover all the endpoints for providers and for payers? Are the resource restricted organizations, smaller payers, and the two doc shops going to be able to comply quickly with these new requirements and turn up their stuff on? So, going back to your question, the EHR vendors have shipped their compliant technologies, 2015 edition cert product, and a lot of them have turned on their FHIR endpoints, but that doesn't mean that now John Smith with NPI 1234 is discoverable, and I, as a patient of that practice, can go get that information. So in my mind, it's much more of a cultural shift than a technology shift in making this happen.
I just echo that, because I always call myself a recovering product manager. I remember when the meaningful use requirements came out, right? And we had to be able to share, data, or we had to be able to send to the patient, right, their information. And I remember thinking, okay, if I was a patient, if I was, my 80-year-old mother, my 90-year-old father, and I'm getting this document that just has a bunch of, data on it, am I even going to understand that? So yes, of course, EHRs can say, health IT vendors can say they're compliant, but if we go back to something Dave said earlier, the whole point of this was to make it easier for patients, to take care of their own care, to manage their own care, to open up. So by just saying you're compliant, I think, folks are missing the point, right? You want to make it easy for doctors, patients, and for payers to be able to really work together to improve the outcome of that for that patient, not just say, yes, I can share data now. And you can see the differences, right, when you're starting to see some of this come in the market now too.
Yeah, and what I'll add on to that wonderful response from everyone is, part of a big part of the goal with this data from an outcomes and an experience point of view, I think is the question of, what was mentioned, what can you use it to do? What kind of products and services can you build on top of it? It's not just to be able to get the data and say, okay, I've got the data. I would compare it to something like a credit card transaction. We've been able to do credit card transactions for some time. that was very different from being able to do credit card transactions through Square, through the internet instantly, from almost any device. It's not just a question of being able to get the data, it's how easy and reliably and consistently can you get the data to actually enable this sort of technology and patient experiences that people have come to expect, and I think will be continuing to expect. And that goes far beyond just, I think, the minimum bar of compliance.
No, that's a great point, Kurt. So like if we think about what the goal is to enable meaningful use of healthcare data, is I think we're all violently yelling as we're working through this. But there's going to be several iterations of how we will interact or exchange this data, the quality of the data, the completeness, how wide it is. Like for the 7/1 date, which is when a lot of these healthcare entities will be going live, I think that we're going to see something much different in a year, or 2 years, 5 years down the line. So, right, like with today's data set, you might just get a glimpse of what's possible, within the future. But I think that as we continue to roll this snowball down the mountain, and it really starts to pick up some mass and some momentum, I think that it's going to just become completely obvious that almost every healthcare interaction will be going through these mechanisms at some point. It just doesn't make sense for every mom and pop healthcare provider, the 10,000 different provider endpoints for every payer, for that matter, to really be reinventing the wheel themselves and having everything behind their closed doors. So as we build out these data sets, improve the quality of them, have a conformance layer on top so that we have some way of knowing, with some degree of certainty, what's going to occur when I call you. Right now, a lot of these things are unknown. So it's even if we were all 100% on board, even barring some of the hesitation that you will see in the industry, it is a monumental challenge on the industry scale. So yeah, I'm certainly excited to see us improve that. I'm very curious to see what this will all look like in 5, 10, 20 years. But yeah, it's going to be a process, essentially.
So I'd like to talk more about that consumer impact for a moment, since, like we kind of alluded to at the beginning, patient data has previously been handled very differently. In the past, it's been mostly under the purview of HIPAA and the OCR, and they take a pretty hardline approach to the handling of patient data. Under the Cures Act, some of the enforcement for patient data is moving under the FTC and other agencies. So David, you've been working with the Karen Alliance to put together a code of conduct for consumer apps to safely and responsibly access this reservoir of patient data. So I'd love to start with you and kind of ask, what do you see as the biggest patient experience and outcomes opportunities for greater data sharing, and also in this era of information security and awareness of the vulnerabilities of our info systems, should patients and consumers be concerned about the security and privacy of their data kind of as we move into a new enforcement regime?
Yeah, I'm going to try to be concise here, and so just start waving when I should stop talking. But they're really important questions, and I think on the first, you're going to really have different use cases for different patients, right? Someone with multiple chronic conditions that's trying to manage their care across 10, 12, 20 providers is going to look very different than a healthy 36-year-old that wants to be able to show his last Tdap vaccine when he moves across the country, right? And really easy to do that. Second piece, the first piece is where we're still having a lot of trouble, but probably where we have the most upside potential, right? So under HIPAA, there's always been the individual right of access, right? There is a right of every consumer, every patient, to go to a covered entity, their health plan, their provider, and request a complete copy of their record. The problem traditionally has been that was going to the HIM department in the basement of a hospital, asking for a paper copy, paying for that paper copy, and then carrying it around in a 4-inch binder from provider to provider to provider. Now we have a unique opportunity as we build out consumer-facing applications to digitize that process, right? We've talked about the need to expand the data sets, right? Right now, the U.S. data set for the U.S. core data set for interoperability is relatively narrow, right? And ONC is expanding that, and hopefully, as we move forward, projects like Open Notes and other things, you can get more and more of your data electronically in a standardized format. But that to me is the biggest and most hopeful piece that allows consumers, their care partners, family caregivers to advance their care, use their information how, where, and when they want it. And that really starts to turn the corner from just having the information to making that information usable in meaningful ways. So that's the biggest upside, right? It's also, could be huge for mom or dad trying to manage the care of their kids. And, I had an experience when we moved across the country and trying to get our vaccination records from Virginia so we could enroll our kids in school in Utah. And it was much, much more difficult than it needed to be, cost more than it should have, and a lot of different challenges. So that those types of use cases, right? Chronic conditions, kids vaccinations, everything in between is really what we're trying to solve for and making this easier for the consumer. Now, the second part is an interesting, and it's interesting to use the word concern, because I would say, no, I don't think people should be concerned about their data and their privacy. I think people should be engaged in choosing a tool that's right for them, that takes into account the security preferences and the privacy preferences that you want. Again, different patients, different consumers are going to have different preferences. If you have a super rare disease, you may want to choose an app that's going to share it with every research study possible. If you don't, and you're super concerned about your privacy, you may want to choose an app that never looks at your data and just kind of holds it as a bank account, right? And so there's going to be a lot of different variations there. And at least from the Care Alliance perspective, none of those perspectives are wrong, right? A consumer has different needs. A consumer should be able to choose an app with different privacy and security standards and protocols that meet those needs. And it shouldn't be my decision. It shouldn't be the provider's decision. It shouldn't be the payer's decision. What those sharing protocols look like, it should be the consumer's. Now, should the consumer have informed, proactive ability to consent to those privacy and security protocols? Absolutely. Should the apps compete on that? Absolutely. And that's what we're really seeing. As you mentioned, our code of conduct, a lot of folks comply with the code of conduct in different ways, right? It's a consent-based code of conduct. Do you provide transparency about data uses to your users? If yes, you can have a whole host of different privacy practices as long as you get that informed proactive consent. So I think app developers are going to be competing on that, and I think consumers should be engaged with what that looks like. But if we're overly concerned about those things, I think it blunts a lot of the utility of those apps because people aren't going to use them.
Yeah, I'll just add to that. I think Dave makes a really good point, because I think, when I think about in the conversations that I have, there's a lot of people who are saying, look, consumers aren't going to understand, right, what they're consenting to. And so there's all this discussion about how do you make it so a patient can understand. And there are all of those different layers, and there is going to be all these different types of apps out there. So I think we also as an industry need to be cognizant of that, because it could also be that we start putting this out there. Someone has a bad experience and they're just going to say, forget it, I'm not going to do this. We want them to have a very good experience where they understand what they're consenting to. I remember sitting through ONC demo and someone said, look, if you consent to sharing, this piece of your record, that means you're also getting these other 80 pieces of data. And, we as healthcare technology people are like, oh, wow, that's a big deal. But, a common consumer, the patient's not going to necessarily know that. So if I go and end up sharing a bunch of data I didn't want to, my experience is going to be bad. So I think, now that we're kind of putting this right on the stakeholders to say, how are you going to do this? But we also need to be thinking of it from the consumer standpoint. So I love what the Care Alliance is doing in terms of, having that code of conduct. And I think we need to take that now, starting to think about taking that a step further of from the consumer side. How do we make sure that they understand also, what they're going to consent to? Because we don't want them to just check the box and say, yeah, I consent to this, and realize later. So.
No, I agree that the caring code of conduct gave people a degree of comfort, where you initially hear, well, there's no guidance out there, or like it's just this very high level. Make sure they don't attack your system. But there's no language in there that really, how are we going to protect the patients and the members? But to Dave's point, I mean, there's a wide variety of patients out there with a wide variety of conditions and a wide variety of how they're going to engage with software and their comfort level. So you might have somebody who's like an e-patient. They're empowered, they're engaged, they're energetic about interacting with their healthcare data, and they're out there trying the apps that aren't even on the market yet. They might even be interacting with the HL7 working groups, or helping to actively advance how patients interact with their healthcare data. And then you have the people like my friends who are like, what's a healthcare portal? I've never logged into one my whole life. Why would I do that? I get a piece of paper in the mail. That's all I care to interact with the healthcare system. And to another point that Dave made, with the various different types of patients, I think the application developers are going to have a tremendous amount of power here. I think that the innovation is really, we're giving a platform for application developers to, with the great economy of scale that can come from working against an entire population, to really innovate. So what I've talked with application developers who are just tickled pink about these regulations, because it allows them to implement things they've been thinking about and wanting to do for a very long time. And just as a quick example, hospice care is very, very tough for people. These long-term care facilities, they're not somewhere you want your parents to go, but if you don't have the expertise in your home, even if you were willing to take in your parents or something like that, you might not be able to do it because you're not comfortable that you can provide that level of care. But through this type of technology, if they were able to share with you their conditions, their diagnosis, their medical history, and you could have an app produce a day-to-day care plan. What do I do when this occurs? And make that to where you can become a part of that care team. I think that would just be really powerful for you. And I think we'll continue to see more and more engagement from patients who would have historically never engaged with their healthcare data, because it's going to become more accessible and more useful. So I think that the function will come before the form, in terms of how a lot of people are interacting with this data. And it's going to take some really innovative people who are willing to go out there and build these things out first, because they have so much faith and trust in the power that we're creating to really set the direction for the industry. So I'm hoping to see a lot more of that occur. And overall though, from the application developers, so much enthusiasm there and innovation already that it does make me very excited.
I'm glad that the two use cases came up there in particular, jumped out at me. And the first one was Dave's passing mention to healthcare for children. I'm a parent myself, and I can tell you, I never had any interest in looking at my electronic health data. But when I'm waiting for results back from my child to figure out if they can go back to school today, if I need to make an appointment, if I should be concerned, suddenly I don't think I could ever go back to a provider that I couldn't get that type of real-time data from. And that was something that we only got access to when we switched our child's PCP in the last year and a half. And as those experiences, and the second example was long-term care or elder care, as those experiences will roll out, I think you're going to start seeing a real impact on competitive advantage in terms of what experiences people expect, what experiences people are using to select, and saying, okay, this is something that is no longer just like a nice to have and something to brag about. Now this is like this has become something that, if a practice doesn't offer it, I don't even want anything to do with it. And so it's really interesting to see the availability of data, even pre-implementation of some of the enforcement deadlines, like, just to have that personal impact on my selection of healthcare.
Yeah, and Kurt, it's interesting that you mentioned that those two use cases, right? Because you also mentioned privacy and security, right? Those two use cases, the permissioning piece is there, age of majority, at what point does the child consent to the parent having or not having access to the full medical record? Josh, in your example, parents making decisions, grandparents, and those permission, a lot of action, again, on the cultural side, more than anything, right? What are the privacy practices that you need to have in place? You're accessing sensitive medical information. That's going to be really important. There's a long road to go. So again, coming back to that, not concerned, but engaged and aware of, to just point about a lot of those pieces and dynamics.
So I'm being mindful of time, and I'm going to try to mash together my fourth and fifth questions on the fly. So please bear with me. I think it'll work. Big regulatory shifts like the Cures Act have a way of opening up opportunities, some of which we have already discussed, for both innovation and investment. So I'd like to kind of go around and ask each of you if there is a particular industry or use case that you think is going to be ripe for disruption or major innovation as a result of the patient data requirements. And I'd also kind of like to throw into this maybe some use cases that lie outside of that kind of traditional patient, payer, provider love triangle, so to speak. Pooja, I'll throw to you first, since I suspect you're going to want to talk about pricing data, and I know that is a personal passion of yours.
Yeah, absolutely. So of course, price transparency, love the topic. So just for those in the audience that may not know what we're talking about, there are two actual rules out now around prescription price transparency. So making sure that as a consumer, you're able to check what your price of your medication is going to be. And so there's one that's requiring providers essentially to be able to see what the cost of your medication is going to be prior to them prescribing it. And then of course, through the Caring Alliance, we worked on actually being able to bring that information to the consumer as well. So I was thrilled to see that CMS actually put out a couple rules around price transparency. And of course, there's now with the Consolidated Appropriations Act, even they're taking that even a step further now. Just a lot of things swirling around what they're calling, to this. I always use the term pre-EOB, but it's essentially saying, you should be able to check and see how much your services are going to cost before you go in for, say, a knee surgery or something like that. And I think that is a really important aspect of all of this. It's not necessarily under the Cures Act, but is a big piece of kind of, things that ONC CMS has been focused on, especially CMS around just getting this information to the patient. So, you're now in charge of your care. Kind of that third leg is also being able to say, I need to know how much it's going to cost me, no surprises around billing. Being able to kind of check ahead of time. But then also, I'm used to going to my local CVS to pick up my prescriptions. If I had the information, knowing that it's actually going to be cheaper for me to go to Walgreens, as a consumer, that's huge. And we don't have that information today. So I think that's one. But, I also, just from the pharmacy side, and I think Josh brought this up, right, of as a caretaker being able to see and understand the diagnosis and things. But we also need to keep in mind there's things out there, digital therapeutics that are coming to the market. And I think, when I look ahead of kind of what's coming next, I'm hearing ONC talk a lot about the fact that we're pulling data out right now, but we also need to be about thinking about the data that's going back into our patient record. And being on the pharmacy side, digital therapeutics, being able to have those kind of software pieces that are tracking your health and sending that information to your doctor is really important. So I think that's a use case that, we haven't really been thinking about, but as I'm hearing ONC at their meetings talking about, kind of the additional use cases, the ability to write data back in, and bringing that pharmacy aspect, that life sciences, the pharmacy into it. I think digital therapeutics is another use case that we don't often talk about, this kind of a little bit outside of that triangle that's going to be really important going forward.
So Pooja, you mentioned the patient being in more control of their own healthcare, and that's a topic that I'm particularly passionate about. So in terms of how we're going to disrupt potential areas of disruption, I think there's many, to say the very least, but one that I would really hope that we can sort of turn on its head a little bit is how the patient interacts with their own wellness and being more preemptive instead of reactive in terms of your own healthcare. So if we kind of, I guess, blue sky this or imagine, well, what's this look like once the data sets are more fully fleshed out, then what we're going to find is that through analytics, we can begin to predict, well, if you keep eating that Reese peanut butter cup before you go to bed every night and having 5 glasses of wine, then you're on track to have this, this diabetes, diagnosis in the future. So I think as people begin to have more and more access to their healthcare data, and if they kind of realize that they can be a member of their own care team, and we kind of almost flipped the incentive model on its head, in a lot of ways. So right now, if you're a fee-for-service provider, which many are, or many who even do take managed care plans, would rather see their fee-for-service patients, but instead of trying to manage that care at a higher level because they feel there's some administrative burden there. If we can take some of that administrative burden off their hands, increase patient and member engagement with their own healthcare data, and then enable that to be seamlessly shared, where perhaps the doctor might get a number that says, "Hey, you get 30% on your activities outside of my office. Like, what's going on? Let's have a discussion about that." So I think that the technology in conjunction with increased engagement is going to be very powerful there, and it's going to disrupt a whole lot in healthcare.
So I'll focus less, I think, on the actor than on the action, and I think we've covered the consumer angle really well, right? I think the entities, whether it's an app developer, whether it's a provider, whether it's a plan, whether it's a wellness company, that can engage the patient and engage the consumer, it can be really, really successful, right? And clinical ways to reduce costs, to increase, improve outcomes. I think that's going to be a big one. And the second is kind of core to doing that, right? It's not just having data anymore. What are you doing with the data, right? These rules, Pooja talked about the No Surprises Act that's coming. We've already seen some transparency requirement and regulation over the last 2 or 3 years for providers and plans as far as posting charge masters and those things. How do you take data that may just be on a sheet or in a file format and turn it into information that someone can use, right? If that's the care manager, community health worker, the individual patient, whoever that is, I think that disruption is going to be really, really important. And it's not that people aren't trying or haven't been trying or aren't doing it, but I think the data liquidity that will come from all of these activities, right? From cures, from the CMS interoperability rule, from No Surprises, will hopefully kind of spur that on in a way that we haven't seen before. So again, that activity of engaging the patient and using the data for something useful, I think regardless of actor, those type of activities are going to be really important moving forward.
Thank you. That were all really excellent answers. So we've had a couple questions from the audience, and one of them actually applies really well to something that we're going to be showing off in just a couple minutes, which is the UX compliance guide that ArcWeb developed with the Karen Alliance to present best practices for developing apps that make use of this patient data. So we're gonna show that off in just a minute. But I was going to ask for closing thoughts, but I feel like everyone kind of rolled them into that last answer. I will throw out the prompt before David and I kind of show off the compliance guide. Are there any additional thoughts that you have that you want to add? Where would you here's a good question. If you have just gotten done watching this presentation and you're like, wow, I want to go and start taking advantage of this, where would you recommend as a jumping off point? I'll ask that to the panel in lieu of closing thoughts. And let's start with Josh.
Yeah, I think that there's quite a few places that you could jump into. Now, I think what I've seen from a lot of maybe some of the newer app developers, they kind of looked at this as interoperability is here. I want to get access to these fire resources, and that kind of means something. It's just not quite that simple. I think you would have to pick a very specific domain and use case. And I think that what you'll find that even though this is a technology standard, pulling data from these APIs is not going to be the hardest part of your job. It's going to be, how do I get the human beings on either end of this connection to have meaningful interactions that improves either their workflows, their health outcomes, the ease of use, engagement, whatever metrics you choose, you'll have to be laser focused on understanding how that data was generated, at what point was generated. Is that really the best source? Are the concepts that I'm pulling from here actually in alignment with the reality of their health outcomes? So yeah, I think that it's going to take a lot of ingenuity and a lot of domain expertise, but yeah, there's certainly plenty of opportunities out there to be had for anybody who's trying to take a run at this.
Yeah, I'd point everybody at the accelerators, at the HL7 accelerator groups, Karen, DaVinci, Argonaut, Gravity, Codex, depending on what your use case is and what you're trying to build your interoperability to do, right? If it's B2B, you really want to go participate in DaVinci. If it's focused on social determinants of health, Gravity is where you need to go sit. If it's consumer access, depending on payer or provider, we want to go to Argonaut or Karen. So becoming involved in HL7, especially given the preeminence that ONC has put on FHIR as the new weighted to transmit data, getting involved in HL7, getting involved in accelerators is a really good place to start.
Yeah, I think Dave took my answer, but I'll just add to that too. I mean, there are a lot of other collaborations happening, stakeholder collaborations. We're involved with one around advanced care planning and e-consent, something totally outside of what we talked about today. But that's the key, right? Is those partnerships, those working together, because that's how you're going to be successful. So yeah, totally agree on the accelerator aspect of this.
Awesome. Well, thank you everyone so much for your insightful answers. Like I mentioned, we do have one last thing, which is kind of showing off some of these best practices for making use of this data that we've been discussing. I have a piece to share, but since we did develop it in concert with the Karen Alliance, I was going to ask you, David, if you don't mind, kind of giving some background on the code of conduct, maybe any additional info on the Karen Alliance and its goals, kind of while I get set up.
Yep. So just really quickly, the code of conduct was built again because as information moves from covered entities into kind of consumer-facing applications, it leaves the HIPAA covered environment. So it's now subject to FTC. And we wanted to create kind of a standard, an industry adopted, industry built standard, whereby consumer facing applications said, this is how we're going to treat our users and how we're going to approach disclosure, consent, and privacy. So we built a code of conduct that worked a lot on the kind of application developer attestations, but wasn't very consumer friendly. And so the ArcWeb folks really helped us flip that and use kind of plain personal language to help folks understand what those attestations mean and how they apply to them. Really going back to one of Pooja's points about making it more accessible to consumers so that they have a better idea of what they're signing up for.
Thank you. Yeah, thank you very much, David. And yeah, to kind of elaborate on that, we had the great opportunity to kind of come in and work through kind of some of the experience, and I don't want to say compliance because I know that has a specific legal definition, but let's say adherence or best practice usage that a startup or an app developer might face when trying to engage with some of this patient data. So we partnered with Karen to develop a UX compliance guide, which basically offers best practices and outlines, the way that if you wanted to make an app that made use of the patient data that is being made available, how would you adhere to the code of conduct? We also touch on things like the educational aspect of it. We put together an example app where we've tackled and worked through many of kind of the UX challenges that are going to arise about, for instance, if you are, how do you convey to a user that this is a Karen attested app, that it is at some level trusted and is, doing its best to adhere to the code of conduct and to work and handle your data safely. And so, we've worked through some of the basic UX experiences that you would expect to go through for an app, account creation, connecting up your insurance, and we've made all this available with the Karen Alliance as an open source resource that app developers and entrepreneurs and innovators and others can use basically as a reference or as a jumping off point when building your own apps. If you want to proceed, you should, adhering to best practices. And again, going back to something that Dave mentioned earlier, it's really about giving patients informed and intelligent choices to manage and engage with their own care and with their own healthcare data. So I dropped the link to that in the chat just now. We're also going to be sending out a link to that after the event through email. And I greatly encourage everyone to take a look at that. And also, if you are an app developer or if you are interested in making use of this data, you should definitely get engaged with some of the organizations that people mentioned, the accelerators, the Karen Alliance, because there's a lot of very smart, very engaged people who are tackling a lot of these challenges in real time. And you can not just, advance your own organization and understanding, you can actually take an active role in contributing to people's ability to engage more effectively with kind of the new horizon of patient data. So I think that about wraps it up. I will hand things back over to our gracious host, Dean. Thank you so much, Dean, for the opportunity for this panel. And with that said, I'll pass things back over to you.
Kurt, Pooja, Josh, and David, really appreciate the depth of the discussion. And when you first approached us with this topic, I knew that we were having kind of very superficial levels of discussion about the significance of it. And certainly an hour-long conversation doesn't even do it full justice. I'd encourage those online, we had certainly a number of them, certainly reach out to these individuals as resources, as experts. But now it's my job actually to tell you that in your chat window is the link for the Remo Room. And we're certainly hopeful that our speakers will be able to join us as well. It'll give you an opportunity to talk with them further, but also talk to your fellow peers, addressing these same issues and challenges. And we invite you, again, give you another few seconds here to click into the chat window, into that live Remo Room link that you see there right now that was just posted by Heidi Franklin on our team. And with that, again, I want to thank, as you're clicking over, all of our sponsors, ArcWeb, Dwayne Morris, Eisner Amper, Troutman Pepper, and certainly Independence Blue Cross. And again, to you, Kurt and ArcWeb, for your leadership in the space and for moderating this panel here today. All right, if you haven't clicked, click now. Head on over to the Remo Room. It's in the chat window. and I look forward to seeing you there for a few minutes. Thanks again, everyone. Have a great rest of your afternoon.